All right, everyone. Okay, so I'm going to first of all start off by saying thank you, Dr. Rehan, for I know it's always a busy day for you, not one particular day, but thanks so much for making the time and talking to all our participants here, our members, cult members, non-members, at home, online, offline, all of the members are here, and I think this session is literally like the need of the hour. It's something that is running on all our minds, like how much workout is good workout, heart health. I think especially after the recent incidents and some losses that we've all had. Um, so I'm going to quickly, introduce Dr. Rehan. I mean, I can just quickly say he used to be a member of the tribe. He works out, very, very regularly, and he's like one of the renowned cardiologists. But I'm not going to end right there with that much intro because there's so much that I have read about Dr. Rehan. So I'm going to quickly read out a little bit of the bio. I normally don't read out anything as a bio, but with Dr. Rehan, I have to do it because there's so much to share. So just give me like 30 seconds and I want to read out, his bio and then I'm going to go all in, okay? So Dr. Rehan, a renowned cardiovascular and thoracic surgeon, he's practiced extensively in India and abroad. He's performed over 10,000 cardiac and 4,000 thoracic surgeries. He's done over 2,000 mini bypass surgeries with 100% success rate, for which he was nominated to the Robert Emory Young Innovator Award by the International Society of Minimally Invasive Cardiac Surgery. So I had to talk about that, Dr. Rehan. I think I've known you for so many years, but I didn't know so much details about you. You're just amazing. Yeah, he has successfully completed more than 3,000 for the entire range of minimal access cardiac surgeries, over 1,000 endoscopic heart surgeries, and a pioneer in the field of hybrid cardiac surgery in India. In June 2016, he founded the Heart Center, which is Bangalore's first standalone center of excellence in minimal access cardiac surgery. Right, the center has hosted many Indian and overseas, doctors to train in the nuances of keyhole heart surgery. Dr. Rehan is the chairman of Motherhood Hospitals, a position he has held since he founded Motherhood India in Jan 2011. And as the chairman of Motherhood India, he overlooks and directs all the activities across the motherhood units, Bangalore, Chennai, Hyderabad. And a surgeon with a heart, he heads the WAS Foundation and NGO, which is working in the field of healthcare and education for the poor, with special focus on women and children. Yeah. I mean, I don't know how you make time for all this. Like right now, he just finished a surgery and he logged in to talk to us. Normally, all our sessions happen at 11 a.m., but we did this at 4 because that's the only time we've got with Dr. Rehan. So, Dr. Rehan, thank you so much. And we have a lot of questions, but before the questions, I'm going to go directly into the recent deaths that we have seen. Uh, any thoughts you want to share on those? Because obviously there are multiple conclusions on that, and none of us really know what it is. But just to kind of settle people in, I mean, anything that you want to talk about before I can ask you other questions.
Thanks, Ray, for that lovely introduction. Yeah, on the recent happenings, and I think people getting a little bit into a panic mode after what happened to one of our dear superstars. But they should also know a little bit of the history of the person in question. They have a very strong family history. That particular family, the one brother has already been stented. There's another. The second brother is also got issues in terms of he's what we call as a vasculopath. He has multiple issues in terms of circulation. Puneet was probably the most healthiest of the lot, but fundamental substrate of a genetics or genes like that put him at risk. He did take care of himself, and it's absolutely unfortunate that something like that happened. But I think here genes played a big role. And as we go along, I'm sure people will ask some questions, and I'll be happy to address that in specific why. Exercise was not the cause, as people say that excessive exercise or whatever it is. I'll address all of that as we go along, with specific questions. But in his case, the unfortunate truth is that he just came from a very bad genetic pool. which put him at a very high risk. And he probably, uh, was just unlucky to be stuck on the wrong side of that genetic issue, and we lost him very quickly. And as questions come up, I'll address each of them in specific
Yeah.
also.
Yeah. Thanks, Dr. Ryan, for that, because I don't think most of us knew that, there was a genetic side to this at all. I think that kind of makes everyone feel a little bit more relaxed. But I want to first touch upon I'll talk about the workout aspect and ask questions around that. But the first and the foremost is, of course, what we are faced with today, right? COVID. And while we all know that COVID is also another viral, like most other viral fevers, it's obviously slightly different or very different. And a lot of people, again, another thing that we've seen is people who have had COVID, who've come out of it, uh, sometimes jump into exercise in a month, in 2 months. Some people wait longer, and is that like um, a good thing to kind of wait it out for 3, 4 months, or should we wait it out longer? What is your advice for the whole post-COVID recovery and exercise? How soon,
Sure.
or how
So
later?
COVID is, we keep making fun of the Chinese.
Can
Can you hear me?
Yeah, I can hear you.
The Chinese made so much of stuff. Everything is a use and throw, but they made COVID, which pretty much lasted and looks like it's lasting really well. COVID is a bad virus. And although it predominantly affects the lungs, it does also have other issues. What we are seeing in the medical fraternity is every organ system has been affected by COVID. You have clots in the leg veins or arteries, you have clots in the heart, arteries that to the heart. Patients are coming in with massive heart attacks, which are actually causing ruptures of the heart, which is very unusual. And the lungs are quite battered, and they become like, thickened. Almost, if you look at it, our lungs and our tissues God's given us are like petals, like flower petals. They're not very thick, but suddenly post COVID, they become really thick and rigid, something like a cardboard. And these lungs now are not capable of performing the same way as they did pre-COVID. Recovery does happen. My advice to people post-COVID coming out with bad lung infections of COVID, or in general, symptomatic COVID, as I would call it, not asymptomatic COVID, which is milder form, but any form of COVID that required hospitalization or injectable drugs or anything of that sort, any symptomatic COVID, guys, take it easy. 2 months of rest is good. Whenever you start, you will fatigue out quite easily. Do not push. Do not push. Take it easily. Start slow. Even a brisk walk of up to 15, 20, and 30 minutes a day is a good way to start. Start with something which is very light on weights, and stay with a very, very easy form of exercise. It might be frustrating for those who are gym regulars, or those who train well, or those who train heavy, but it is better to start slow and better to take it easy rather than push yourself. So what are the cons of pushing yourself? Sudden death is a big con to pushing yourself.
Hmm.
Stay well hydrated also, because in general, COVID patients do have a tendency to clot formation. Hydration can also further predispose. So stay well hydrated even when you're exercising. So you at least avert some of those other issues that can happen. Your body will tell you, well, you will be exhausted. The same 3 burpees that you could have done, without batting an eyelid will feel like the end of the world to you. But then that's how it is. It may take some time for you to get back to close to normal, where sometime could be a month in some cases, or even 6 months in some other patients. So that is very subjective. So don't compare that he got better in 2 weeks. Why am I not getting better? It depends on how much of your lung was involved and how much of that was, resolved or came out without fibrosis. If you had significant thickening of the lung, you are going to be left with certain things which you have to work with, build yourself, and then get over them over a period of
I have a question, right? Like people are talking about subclinical myocarditis. Is that what it is? Uh, and it's it's what is doing the rounds right now, especially after the recent that's saying that people with COVID, post-COVID, even after like 5 months and 6 months, your heart has some sort of inflammation. Now I obviously don't know any of this, which is why I'm posing that question to you. And even after 6 8 months, when you kind of exercise with a certain intensity, if it's especially very high, then chances of this heart attack is possible. Just wanted you to throw some light on that one.
So viral myocarditis is well-known entity, but viral myocarditis, like any other viral event, also goes away. It doesn't stay forever. It's not like what people are talking about. So even if you have a myocarditis, and if you really want to know whether you have it or not, the best thing for you to do is to do a blood test called the CRP, or C-reactive protein, which is one of the indicators of inflammation in your body. Anywhere there is an inflammation in your body, the CRP will be elevated, more so if you have a myocarditis. And that was one of the parameters that we monitored during the COVID era, where we basically looked for CRP. Highly elevated CRPs meant that
Hmm.
you have a significant amount of inflammation in the body.
Hmm.
So if your CRP is normal, you are well and truly out of COVID in terms of time frames and everything. I think we are just pushing the button by saying that it can last for so many months. No, I'm not. I don't think that is the cause of it.
Okay.
I think it's just that with all the organ systems being stressed so much with COVID, one has to take it slowly, like I mentioned some time ago,
Yeah.
and
Yeah.
then restart your exercise like as though you're coming out from zero,
Yeah.
and build it up slowly, and don't go jumping into very aggressive workouts.
Yes, absolutely. There is a question if so is ECG, TMT, echo, are these needed for someone who typically does a high intensity workout?
Right. So I can address. I think Devi Shetty addressed that on national television also. But so I'll explain what it does. A resting ECG, a resting echo are actually of no great value, because when you're in resting state, you can be absolutely normal. You can have a normal ECG and a normal echo completely. A treadmill test, which is an exercise test, basically might throw some light on it. And if you have blocks, and only if you will it actually show what
Hmm.
is going on inside. Very often you can have a normal TMT and you can still have an issue 2 days later.
Hmm.
So I come to that. I think in an Indian population, as a population, we are genetically predisposed to coronary artery disease. We cannot, I repeat, we cannot compare ourselves to Western data. We
Hmm.
do not belong to Western heritage. We cannot compare ourselves to Western data. As Indians, we are more predisposed to coronary artery disease.
Hmm.
We are seeing it at a much younger age group than the Western population. I think it would be extremely safe for anyone with a family history, or a smoking history, or a diabetic history, or hypertension history, in who's going to start working out fresh, to look at getting a complete cardiac workup done, and that should include ECG, echo, treadmill tests, and a CT coronary angiogram. Why? Because in a CT coronary angiogram, you look at two things. You look, one, for what is called as a calcium score. A calcium score shows that you have cholesterol plaques and which are calcified and are sitting in your arteries, but not causing an obstruction. And the
Hmm.
second thing is to look at whether there is an actual obstruction, like you look in a regular angiogram. Guys and girls, please understand, a high calcium score puts you at risk of sudden cardiac death if you are training for something which requires a high intensity of working out, because these plaques can rupture and cause death. This is exactly what happened to Puneet. One of such plaque ruptured, causing an obstruction in a major artery. not even giving him time to reach the hospital. Between his physician's clinic and the hospital is 5 minutes driving distance. And he didn't even get 5 minutes of time. So, to give it to you in a layman term, you have all these fancy, beautiful trees on the side of the road,
Yeah.
and there, and they form this, this arch of shade and everything for you. They're great, and they stay on the side of the main road. But if they happen to, fall across the main road, they obstruct the whole road. This plaque, this calcium plaque, is exactly like that. It stays stuck to the side of your artery, does not cause any block, but when it breaks, it falls
Breaks.
right across your artery, resulting in a 100% block, which in the wrong artery can end up in a disaster and can cause even death.
Wow. Okay. Now, Creator is asking if a person is following a very healthy lifestyle, food is good, regular workout, stress-free living, but is genetically predisposed to heart issues. Will that person have heart problems because of
Yes.
genetics only?
Yes, they can have heart problems. By doing all this, you might probably be delaying the onset of these problems, and you can probably even stay away from them, but it requires consistency, and it requires, consistency of this good lifestyle. Then maybe you can get away. But if your genes are very strong, let's say I have a family history where both mom and dad's side at 45 to 55, all of them have had heart attacks or something,
Hmm.
then there's a high likelihood that I might also get stuck somewhere. Maybe not at 45, but maybe at 55 or at 60 years of age.
Hmm.
But at some point, the genes will catch up on me.
Hmm. But then there is like if I can consistently, live a decently healthy life, then there are
You
chances that I
can
can,
you can keep it away. That's all.
yeah, yeah. Okay. Uh, okay, so there is a question, I think a couple of questions on lipid profile. Like I got this lipid profile done. All parameters are fine, including cholesterol, but triglycerides are 340. He's living a healthy lifestyle, tries to exercise every day, eats balanced. Should he take like medication or continue the healthy lifestyle?
No, triglyceride 340 is high. You need to take medications. You can start yourself on something called phenofibrates. You can drop your triglycerides down, and then from there on, try to maintain it. For you to get it from 360 down to say 150, 160 will take a long time, and you're at risk during that time. So I suggest take 3, 4 months of medication, get the triglycerides down to the range that you want to, and then you can maintain it.
Yeah. Now this is a question that's going to be mostly asked by most of us. How much workout is good workout? And I'll just detail it a little bit. I know all of us talk about, moving often, walking, through the day as in just being active, workout for like 30 minutes, 40 minutes every day. But sometimes I think some of us end up doing like 2 sessions a day, maybe a session in the morning, a session in the evening, or maybe we do back-to-back sessions, or sometimes maybe we end up even doing 3 sessions. It doesn't all have to be cardio intense, but it could be different type of workouts, right? So I know this also will differ from a different body type, age, all that. But according to you, doctor, what is like, where does anybody draw a line? Like,
So we'll take the minimum. I think 30 minutes a day of some form of exercise is something that everyone should be doing. Either 30
yeah,
minutes of walk or 30 minutes of whatever. I mean, if you're doing maybe Zumba and all, you cannot do 30 minutes. It's not that easy to sustain for everyone. But in general, any form of exercise of at least 15 to 30 minutes a day is a must. Now, when you're talking of doing too much, I think for regular athletes or regular people who work out, who have been working out for very many years, a sustained systematic training program, 2 sessions or even 3 sessions a day does not matter because they know how to take care of their bodies.
right.
Fundamentals. A lot of us do not warm up and warm down efficiently. That's our biggest blunder, biggest mistake. Everyone is in a hurry. to get into the class and get out of the class. And that is the cause of majority of our injuries, because we have absolutely zero mobility as we keep going along. Second is hydration. Third is food. And then lastly and most importantly is the rest factor also.
Sleep.
The right amount of sleep and thing. So people like say elite athletes or people like you are in the fitness industry, which is what you do. The all of you know exactly how to warm up, warm down, give yourselves that break time, and make sure that you get everything in order, right? But that's not the same for the lay public. They believe
Yeah.
they can emulate all this straight off the back and try to go after it. That is not possible. I think for a lay person, let's say the large majority of the public, I think you should look at a single session a day, probably 5 days a week. Or if you're doing 6 days a week, then you need to throw 4 days of workout and at least 2 days of mobility into it, and one absolute rest day. And please ensure that everyone gets at least a good 6 hours of sleep every day.
Hmm.
There are many, many, many reports where you can take people, marathoners, Ironman competitors, all in their late 30s, early 40s, dropping dead. Only single common thread in all of them is the lack of sleep. Most of these guys have been on 3 to 4 hours of sleep and they just drop dead. Sleep is extremely important. If you want to stay fit and exercise a little bit more than normal, please ensure that you get 6 hours of sleep at the least.
I think that's yeah, that's like a great takeaway, because all of us, keep talking about recovery, the right food, protein, so on and so forth, and we do talk about sleep, but I don't think many of us take sleep seriously. But I think hearing it from you, doctor, that's going to go home with all of us. Amrish is asking this question. Sometimes when I do 1 minute burpees, right? It's like unlimited burpees in 1 minute. My heart races and I can feel it beating like really fast. Is it fine, or should I scale down or avoid such exercises with that sort of intensity?
That depends on, for a, how old is Amrish?
Not very sure, but I'm guessing, early 30s.
Okay. So, I mean, if he's someone that trains regularly and is used to doing exercises that take your heart rate up to that, then it's fine. By a thumb rule, it would make sense for example, you take 200 minus your age. So let's say if he's 35 years of age, uh, 165, he should not be holding a heart rate of 165 for more than 8 to 10 minutes
Hmm.
at a stretch,
Hmm.
because unless he is a trained elite athlete, only the really trained elite athletes can even think of getting close to holding that kind of intensity for that period of time. If he is
Hmm.
doing it for 1 minute, fair enough, he can do it for a minute, but he needs to let it settle down and come down all the way. He can't keep holding it at a sustained high heart rate. Then there is a problem. What everyone can do safely is to hold a heart rate in the range of 130 to 140, and
Hmm.
it's absolutely safe. The, you are able to push yourself reasonably well to build good fitness. At the same time, you're not pushing yourself crazy to run high risks.
Hmm. Got it, doctor. So basically, we all kind of measure our max heart rate, our max training heart rate, right? Like you said, with the calculation of using 220 minus age. And it's okay to hit that max heart rate, right? You're only
Correct.
saying that don't hold that max heart rate for
Correct.
a long duration of like
Correct.
5, 8, 10 minutes. Okay. And the safest zone is always going to be your between 130 and 140 heart
Correct.
rate.
Right.
Okay. Got it. Divya is asking, what is the best workout regimen for a person who has undergone aortic valve replacement?
Aortic valve replacement is actually they're back to normal now, right? Because you replace the valve. So technically, they can get back to doing everything that they want. There is absolutely no reason for them to hold back. Uh, the valve has been replaced, and the whole idea of replacing that valve is to, get them back to what they would like to do.
Yeah. Great. What is the difference between BPM and blood pressure?
Oh, a lot of difference. BPM is beats per minute.
Yeah.
That's your heart rate. It has nothing to do with your blood pressure. Your blood pressure, BP or blood pressure, is got to do with the actual effect of the heart pumps out blood at a certain pressure, and that pressure that the arteries in your body actually feel, that is blood pressure. So beats per minute is your heart rate per minute, the number of times your heart is beating per minute, and blood pressure is completely different.
Right. Now, with your workouts, of course, you spoke about how much workout, how much recovery, and rest period, and etc. Um, some of us have the tendency of doing a lot of cardio, right? The layman I'm talking about, people who regularly work out, and we always talk about switching it up, mixing, strength training, yoga, all of that. So, would you advise like cardio on a regular basis or every day? Or is it okay if we even do cardio for about like 30 minutes every day, but adding on that weight training is that much more important?
Yeah. So see, cardio is good, but if you put it into a perspective that I will tell you now, then you'll understand why strength training is equally important.
Hmm.
As we age biologically, we lose muscle mass
Yeah.
and we gain fat largely in that place. So, what are we trying to achieve when we start exercising? If you look at people who exercise regularly, it's a fact that majority of them look far younger to their actual chronological age. And that young looking thing comes from the fact that their biological age is much lower because they've dropped their body fat percentage quite significantly. And they've increased their muscle mass, not just dropped their body fat, but they've increased their muscle mass. And thereby they've dropped their biological age. You cannot increase muscle mass doing cardio alone. You cannot increase muscle mass doing cardio alone. You need a certain amount of strength, or you will have to do metcons or HIITs, which have a reasonable amount of strength exercises built in a different format. But if
Yeah.
you're taking pure walking or running consistently, then you will only burn up to a certain amount of fat, after which you start stagnating. Even runners, even hardcore dedicated runners, they need to do strength to avoid injury. They need to do strength to improve their performance. Just running every day will not help them get better as they go along.
Got it. So basically, the answer is like mixing it up, right, on a regular basis.
Absolutely.
Yeah. And also with cardio, doctor, like, would you, of course, we all do like different intensity, and of when you're training together, or you have your trainer, there's a lot of pushing yourself. And if we are not really wearing like a smartwatch, looking at our heart rate at what level it is at, zone 2, zone 3, zone 4, how does one kind of, um, you know when to push and know when to kind of stop? Like, is it just purely looking at how breathless we're going at that point, and then when to back off?
Yeah, I think if you don't have any of one of these, heart rate monitors, then the only way is by feel, where you know exactly, when you would know in terms of you're getting out of breath or whatever it is, uh, where your limits are in terms of getting a breath. Also, you will know from your muscle, like, at some point the burn is going to be quite bad and the lactic acid accumulation might really, get. If you really push beyond that, then you probably would start getting lightheaded and those kind of things, which I don't advise
Hmm.
you to do.
Yeah, yeah, fair. My heart rate is very less. Okay, 50 to 60 is not very less. It's great. Okay, but my heart rate is very less according to him. And while sitting idle and normal walk, is this okay?
It's damn good. He's got a very good resting heart rate. He must be a fit guy then. Because most people with good low resting heart rates have good cardiovascular fitness.
Yeah, I think that answers everyone. And then just to reiterate that for everyone, doctor, I think we should let them know that what is, low, like a low heart rate, what's like the threshold there.
I think if you're looking at resting heart rate is typically measured before you get out of bed in the morning. Like that's the most accurate way of doing it. So if you're wearing a smartwatch, you just open your eyes and you just woken up, then just take a look and see what your heart rate is at that time. I think for anyone, staying between 50 and 60 is very good. If you can stay even between 45 and 50 or 40 and 50 means you're really, really fit. That you find a lot of people who are like runners and people, who are regularly into high intensity workouts might be having those kind of heart rates. But in general, resting heart rate up, between 40 and 60 is a good heart rate. You don't have to be worried. It's not a very slow heart rate. Once you start your day, you'll find that this heart rate moves up into the 60s and the 70s. But in general, if you can have a heart rate which is, say, 75 and lower, means you're reasonably good cardiovascular fitness. That's what it means.
Awesome. How accurate is a Pi score and Hunt study to follow for heart health?
How accurate is it?
Pi score and Hunt study to follow
I,
for heart health. Yeah, I mean, I don't,
I
yeah,
haven't even known.
yeah, okay. Right. Then there are some questions on, stress and hypertension. Like, people who are dealing with stress of various forms, right? It could be personal, professional, so many forms of stress, and people who have hypertension. How do how can they plan their workouts? Like, would then, intense workouts, make a difference, or would it actually cause more harm?
So intense workouts might be hard for them to do because it will further increase the blood pressure and it could go very high. So it might be
Hmm.
dangerous, and I wouldn't recommend intense workouts. They
Hmm.
should do, gradual workouts. They can start with walking or those kind of low intensity workouts. They can stretch it over a period of time, meaning they can do a little longer workouts rather than doing like it kind of HIIT workouts. The HIIT might be a little hard for them to do.
Hmm. Hmm.
But in general, working out will help them because working out will reduce their stress also. It will keep them a little bit free from that. And it will help control the high blood pressure also to a large extent.
Yeah.
But stress and blood pressure are directly related. Higher the stress, higher the blood pressure.
Right. And Namrata is asking, how does stress particularly affect our heart?
Stress can affect your heart in many ways. It can cause you to have an increased heart rate because of the anxiety or whatever levels. Stress triggers off a lot of emergency hormones like your adrenaline itself, which can cause elevated blood pressure, elevated heart rate, elevated demand from the heart per se. And if you had some blocks or something, they could even end up in causing heart attacks at that given point in time. So
Hmm.
that's how stress can cause heart attacks by themselves. Uh, we even have a condition called stress cardiomyopathy, or which is got nothing but just simply stress, which causes severe heart failure, which can recover and sometimes, unfortunately, may not also recover. And you might end up getting listed for transplant with these things called stress cardiomyopathies. So, stress in general is bad. I know with present day life, it's not easy to say just get out and not have stress in your life. But I think we need to be a little bit prudent about it and see what we can fix and what we cannot fix. If there's something that's causing you stress that you cannot fix, there's no point, losing your life over that.
Hmm. Yeah, absolutely. Uh, Shadab is asking, is HIIT safe in terms of regular heart health?
Yeah, HIIT by itself is safe. You just got to be well, you have to build yourself to get to that. You can't get into very hard HIITs. HIIT can start from a beginner level to any level. HIIT
Yeah.
by itself is a wonderful form of exercise. You can get a lot done in 10 to 15 minutes and benefit from it. So I don't think it's the form that's bad. It is just how you apply it that is important.
Hmm. 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 So, Dr. Vanessa, how you apply it? I mean, would you be like able to give us a
No,
little
I think
more?
people need to understand that you can't get up one morning and say in 1 week I want to become fit.
Hmm. Hmm.
That's a misconception that everyone has. They want. I mean, a guy who's 100+ kilos, morbidly obese, in 3 months he wants to lose all his weight, and he believes HIIT will make him lose his weight or whatever it is. Obviously, it doesn't work like that. Anything, if you start slow, build it up, sky is the limit to what intensity you want, you can achieve. But it's a
Hmm.
part of training. And I think that's where a good structured training program, a good trainer, a good, a good schedule on how they handle, and that is important. Because if you're just going to blindly follow internet-based schedules, you're going to end up in big trouble. Either you will have multiple injuries, or you could end up having a disaster like a major heart attack or something like
Yeah, yeah. Hima is asking, I used to have BP issues, but in the last few years, with lifestyle changes and healthy diets, I am fine. I don't take any medicines. Is it okay to continue, you know, carrying on this way?
that. Absolutely. If you've been able to get off that and you're able to, monitor and maintain your blood pressure, great. You should continue doing what you
Yeah. Puneet, I never run below 170 BPM and my age is 40. Is
do.
that,
That's
I mean,
very
he's like,
high.
I can't run. Yeah, he's like, I cannot. Okay. So basically, you're saying,
Why should
yeah,
he be
one.
running 170 BPM? Meaning, I didn't get him. What
I
did he do?
think Puneet is trying to say that without even like running too much or too fast, I think his heart rate's already like going up to
So
170.
then he needs to build his cardiovascular fitness. He needs to start conditioning himself. And
Hmm.
as he keeps, doing what he is, he'll find that his heart rate starts to settle, just like anybody else.
Okay, got it. So basically, then, don't like run longer distances or too much right at the beginning. Start with like,
No, actually, you get into a pace. Like if you're running, he can get into a pace where he keeps his heart rate at around 150. So every
hmm,
time it goes up beyond 150, 160, he can either stop and walk, let it settle
hmm,
down, or
hmm,
drop the pace down till it settles down, whichever one works. Over a period
got
of
it.
time, you realize that he does not need to stop or walk or do anything. The adaptation is now in place, and he's able to maintain a steady, pace at that
Yeah,
heart rate going forward.
yeah, yeah. Uh, my father has a left bundle block problem.
Bundle branch block.
Yeah, is it safe for him to do yoga and walking at slow pace? What kind of workout is typically safe otherwise for?
Walking is safe, yoga is also safe. A bundle branch block will not cause too much of trouble for him in terms of exercising. I don't think he'll have an issue.
Yeah, walking. Yeah, I think it's like the go-to for. Diksha, can you can just doing yoga every single day avoid heart attack even if it is genetic?
Yoga is good. I mean, if you take the broad base of yoga and say, I do different forms of yoga, but I do some yoga every day, then yes, because yoga a, can be a very hard exercise also, unlike what people think. It's not just relaxation. It is tough to hold those postures, and it really works you out quite a bit.
Yeah,
So
yeah,
you can push things back, and you will stay healthy unless your genes are very strong. And with a good diet and yoga every day, you should be able to put things behind.
yeah. Sumit's asking why muscles around heart and lungs are weak.
Why?
Why are muscles around heart and lungs weak?
They are not weak. Your heart beats at 70 to 100 beats per minute for so many years. In no way it's weak by any stretch of imagination. I think it's what we do to it that makes it weak.
Yeah,
I think if we take care of it, it should be fine. If you make sure you eat right, you don't have any blocks, then it's good. You get good blood supply to the heart, it's happy.
yeah,
And if you exercise it appropriately in the right, like we're discussing, then it's good.
yeah, yeah. I think we've got this question on supplement, and I remember, Doctor, we were discussing this, I think, last week on how supplementation, wrong supplementation can also cause a lot of, heart health issues, right? So we have a question on, can you please throw some light on supplements? Does taking supplements such as protein or, I don't know, anything else affect health, heart?
So, so if you're working out well, like you've done a reasonably good workout of, say, a good 20 minute of HIIT, or like 40, 45 minutes of walking, or a good 1 hour Zumba class or a body pump class or anything like that, then it makes absolute sense to have protein supplements, because they do repair microfractures in your muscles. They get rid of the what we call as the DOMS, or the delayed onset muscle soreness. So you come out of it quite well. BCAA is also okay because it hydrates you quite well, and it gives you that ability to get back quickly, just like any other hydration would do for you. So these are good if you get till there. I think the thing is, the most important thing is to know what supplement you're taking, like, and why you're taking. Just dosing up on creatinine kinase and all those kind of things which are muscle building. Please understand that that's a load of protein that goes onto your kidney. All these proteins are going to be thrown out through the kidney. And if the kidney gets a load that it's not able to handle, then you're going to end up with kidney issues, which means kidney failure, secondary to a toxicity because of an overload. So that is something. So unless you're expending that type of energy and that type of muscle burnout, then only it makes sense for you to supplement yourself with high protein shakes and things like that. There are a lot of supplements that are there in the market which do not even have a label on it. And those are problematic because we don't even know what is there in it, what it contains, and how it is going to respond or react with your body. And those supplements have taken lives. We have seen it happen as cardiac surgeons and cardiologists. And I think that's an absolute no-no.
Hmm.
There are some nutritional supplements for everyone that you can take, which are okay to take if you're taking like once a day. Like you can take antioxidants, which are good for health period across the body. You can take a supplement of vitamin B12 or vitamin B complex vitamins. But please understand, if they are in excess, the body will anyway throw them out and only retain what it needs.
Hmm. Hmm.
All vitamin supplements, all supplements are okay if they are taken as required. That is, if you're not getting enough of it in your diet or those things. Eh, Anything in excess is bad. They all have their own side effects, and one should be careful of.
Yeah. Yeah. Somebody is requesting for you to throw some lights on the POTS syndrome, POTS. She says, I'm unable to find any help on this. Managing POTS syndrome.
POTS syndrome. Huh?
Yeah.
I think if she can elaborate on that POTS syndrome, where is she getting it from, then I can tell you, because the abbreviations are an issue.
Yeah. It says POTS.
Let me just find what they mean by it.
My echo
You can ask
TMT
me another
ECG are
question
normal.
until I find that. I'll come back to
Yeah. Yeah. My echo TMT ECG are all normal, but I get some kind of palpitations when I sleep due to stress and anxiety, which started from June this year. Should I
you.
do any particular blood test or medication to get back to normal self? So it's only in the last few months that he's saying he's been getting some sort of palpitations when he sleeps, and it's primarily because of stress and anxiety.
Yeah.
So
So he's
any
basically
test.
having something like a panic attack or an anxiety attack at night. Uh, Yoga itself is good to reduce anxiety and those kind of things. Any meditation is good. Any yoga is good. If you're talking of medications, then you have some group of drugs which are anti-anxiolytics, and then there's a group of drugs which are beta blockers, which also will reduce the palpitation. But I think for him to get on medications, he should see a doctor at first to know whether this is just a panic attack or is this something more than a panic attack. Otherwise, the first to go would be just meditation, calm yourself down, and try to avoid any form of tablets or anything. Try the other modalities before you go to the tablets.
Yeah. How do
On POTS syndrome, basically POTS syndrome is postural tachycardia syndrome. Basically, what happens is when they are like what do you call, when they are standing or something, they tend to have higher heart rates.
oh,
So that's basically what it is. These patients, I think the best thing for them is to stay well hydrated. Because if you're well hydrated and your body's got really adequate volume status, then the chances of you having any orthostatic or standing up hypotension or drop in blood pressure causing this tachycardia will not happen, number one. Some of us, in spite of that, if you still have it, then you need to check your steroid levels and see what your corticosteroid levels in the body are. If they are low, you might have to supplement it. If they are normal, then it's nothing to be done. And if it's only purely a heart rate issue, then you can actually put them on beta blockers. Beta blockers will reduce the heart rate. And there are some selective beta blockers which will not touch the blood pressure and only reduce the heart rate. They would probably be preferable drugs that they can take.
Right. Yeah, but they should do it with a consultation, right?
Yeah,
With
yeah.
the
They should see a
yeah.
physician for the same.
Yeah. Yeah. How to reduce the non-HDL cholesterol through lifestyle changes when they're at borderline levels of 150?
Workout. That's the best. Nothing,
Okay.
there is no medicine to convert bad cholesterol into good cholesterol. The only medicine is working out. If you
Awesome.
work out, then most of your bad cholesterol that gets collected as good cholesterol or HDL cholesterol rather than the non-HDL.
Got it. Is fasting good for the heart?
Yeah, fasting is good for every organ system.
Yeah, but again, I think there's a lot of thing about fasting also, right? A lot of people doing different types of fasting, and some of us not doing it with proper supervision also, have to deal with acidic issues and all of that. Yeah.
Yeah, no, acidity is, of course, if you're empty stomach and you have a tendency to have acidity, you're going to have all that. In which case, fasting is not very good for you.
Yeah. Yeah.
But in general, fasting is a very good detox for the body,
Right.
in a way. Up to 12 hours is absolutely fine. And
Hmm.
most of us would be able to tolerate up to 12 hours. I think
Hmm.
when you push the limit with intermittent fasting of 16 hours, then it becomes an issue because it can be difficult for some people to get up to 16 hours.
Got it. How useful are chest heart rate monitor for runners?
Very
The
useful.
the,
They're
the
good. They're quite reliable.
straps.
Yeah, yeah. You have the one from Polar Tech, I think, which is pretty good.
Right. Right. And someone's also asking how accurate are, the smartwatches that we wear. I mean, there are a host of different watches, and all of us wear so many, right? From Fitbit,
What is he
Apple.
trying to measure with these smartwatches?
I think
See, if you're just
most.
measuring your steps, they are like any pedometer device, they will be accurate.
Hmm,
But if you're talking and if you're going to measure your, say, your heart rate, then they are using the same sensor technology as your pulse oximeters because
hmm,
you place your finger at the camera port basically and pick up the heart rate from there. So that's also the same technology. It's reasonably accurate on your heart rate. Beyond that, really nothing else. I don't know how they are able to calculate so many calories and that kind. That's
hmm,
always been a big plus or minus over there. But
hmm,
I think with technology, they've become close to being accurate. They're not perfectly accurate, but close to being
hmm. How to keep BP and diabetics under control, and how are both related?
accurate. They are not directly related. They are just a constellation of disease processes that people end up together with. Diabetes diet is the mainstay. It is the basis of everything. If you have a good healthy diet and good exercise, then you can manage your diabetes quite well. The diabetics who are online, people, you need to understand that exercise is your best friend. And
Yeah.
using large muscle groups during exercise is again what you should be focused at. When I
Hmm,
say large muscle groups, I'm talking of back, glutes, legs. And so for diabetics, something like squatting and all that is a wonderful exercise.
hmm,
Reason being that there is endogenous or insulin from within the body that is secreted out of these muscle groups, which
hmm,
your pancreas is not able to do. So you are producing your own insulin from here, and that
hmm.
controls your blood sugar levels. And you might be able to get off medicines. Cycling is a wonderful exercise for you guys. So even static cycle is a good deal because it works those muscle groups.
Right.
Hypertension is, uh, I mean, majority of hypertension that we get is what we call an essential hypertension, is again a genetic predisposition to a lot of us. So for hypertensives, basically we just need a healthy lifestyle, reduce salt intake, and stay free from stress and well controlled. Don't ignore it. Take tablets if you have to, so that you prevent end organ damage. You cannot avoid hypertension, but you can ensure that it doesn't cause you any damage.
Hmm. Hmm. Got it. Gauri yeah, this is a good question. I think we didn't touch upon this yet. Is there any relation between thyroid and heart health? I'm someone who's on the borderline of hypothyroidism and I train 5 to 6 days a week, and thyroid, like heart issue, runs in the family.
Yeah, there is a connection. Hyperthyroid people will have a higher heart rate, higher blood pressure, increased metabolic demand from the body, and that's not very good. So I'm sure if you're hyperthyroid, you should be on something, either beta blockers or any anti-thyroid medications to keep your thyroid levels under check. A higher thyroid level does add metabolic stress demand to the heart. So, and if you're working out in addition, that will be an added demand to the heart.
Hmm.
So, hyperthyroidism adds demand. Hypothyroidism, which is low thyroid levels, it basically slows down your entire metabolism. So it can get you to become obese. It can add to your diabetes. It adds to the other metabolic issues that you have. So both of them, the thyroid health is extremely important, and staying
Hmm.
neutral is very important.
Hmm. Hmm. What are the symptoms to look out for any heart disease?
So heart disease, the symptoms to look out for is chest pain. Uh, Very common that everyone says left-sided chest pain, radiating to the left arm. That is only seen in 10% of the population. The majority of us will present with something like acidity. Every time
Hmm.
we eat, we're getting a pain, which is like a burning pain at the back of the chest, or a jaw pain, or a pain which is somewhere in the chest. You're not able to put your finger and show exactly. But there is a consistency that it is either there when I'm walking, or when I'm after I eat, or if I have some stress. Then that's something that you need to check on. A common mistake of lay public is to pass it off as acidity and then get stuck, much later, having realized that I have had an attack, or I'm running one bad one as we talk, or something like that.
Hmm. Hmm. Hmm.
If you are having any valvular heart disease, or you're having like heart failure, then more likely you will have shortness of breath. You'll start seeing some swelling in your legs, and your shortness of breath will be progressive. With time, you will find that the distance that you're walking becomes lesser because you're totally worn out, and you're really gasping for breath for the to even walk, say, 100 meters or a kilometer or whatever.
Hmm.
So these are the most common things that you get.
Hmm.
Sometimes people get palpitations, especially those with thyroid issues. They can present with rhythm disturbances, which are only present as palpitations and nothing else. And they are generally manageable with medications. Very rarely they might need some intervention. So these
Hmm.
are the broad three categories under which you will find heart symptoms coming.
Right, right. After exercise, I tend to get headaches. Um, any reason why this happens?
Most likely your blood pressure must be high at that time. That is the most common cause. If it is not that, then you're terribly dehydrated and you need to drink a lot of water, because that can also cause headaches.
Right, right. Okay. Any post-COVID advice like how to recover heart and lungs? I think this
Nothing.
is,
We spoke about that in detail, right? Just rest it out and then start
yeah,
gradually, and you'll be fine.
yeah, yeah. Any foods for heart health?
Foods for heart health. Yeah, I mean, anything that is low on fat, low on salt, none of this fried stuff is all pretty good with heart health. In terms of fruits, pomegranate has got a lot of antioxidants there. That's good for the heart. Uh, so basically, any antioxidant fruit which is good, that's pretty good for the heart.
Yeah, yeah. From what age would you recommend, full body checkups?
Indians, I think now are the age for heart attacks has come down to well below 40 also. So,
Mm,
like I said, if you have a family history or a smoker or a diabetic or hypertensive, then you should look at doing a full heart check every year, say any time after 35 years of age. Uh, if you don't have any of these, then use 40 as your benchmark.
hmm. Got it. Uh, any particular advice for people who, start working out slightly later in life, like post 35, post 40? Yes, of course, everyone, whoever starts working out at whatever time, need to start slow and then slowly progress. But any particular advice, doctor, for particularly, women, men over 35, 40 years of age?
I think anyone over 40 years of age in India wants to start exercising. I strongly recommend that you get a a calcium score or a CT coronary angiogram done. Get
Hmm.
a routine heart check like ECG, echo. Get your blood test done for cholesterols. Make sure you're not a undiagnosed diabetic. Just rule out all of it, and then start like we already discussed. Start low and build it up. And once you know this is clear, then you at least know you're not running any unknown risk. That's
Right, right. And this is easily, like, one can do it
yeah, it's easily
at
available.
a
It's all in a day's work. You'll get all your reports by the end of the day.
right, and we don't need like a doctor's, a cardiologist's prescription to get these done.
I think CT coronary angiogram you may need, but for the others you don't.
Right, doctor. There is one question on, okay, my dad has myasthenia gravis. Does it go to the
Myasthenia gravis. Myasthenia
does it go to
gravis
the
is a
heart?
disease of the muscles. It's a neuromuscular disorder. It does
Okay.
not affect the heart primarily per se, but generally it's an autoimmune disorder where the body thinks that the neuromuscular junctions are foreign and starts attacking them. And one has muscle weakness as we go along, and that is the thing. But per se on the heart, direct impacting on the heart alone as an isolated organ, it doesn't do anything.
Right. Does depression or bipolar disorder cause heart ailments in the long run?
Due to stress and related those related issues, yes, but not per se bipolar or depression causing it, like by itself. It
Hmm.
doesn't. But in general, someone who's depressed and bipolar or remaining phases, they do have their share of stress and the effect of those things.
Yeah.
So it is like a collateral damage. It's not a direct damage.
Right, right. Does pain around the right side of the chest is of any concern? Is it to be worried about?
If it's consistent, if it is related to activity, and if it is relieved at rest, then I think yes, you have to be concerned about it. If it is like flitting, today it is
Hmm.
on this side of the right chest, tomorrow it's 3 levels above, it is not at the same site or the
Hmm.
same type, and it is unrelated to any activity, then I think it is purely a muscular pain. You can let it be.
Right, right. Swati, so like first aid in gym for heart ailments. I think first aid for heart ailments should be anywhere, and not just the gym, because it can happen anywhere, right, doctor?
Yeah,
Uh,
that's true.
it doesn't.
See, I mean, if they are having a heart attack and if you have access, then you can at least get them and give them aspirin, because an aspirin, if they're able to take it immediately, will
Hmm.
reduce the intensity of the heart attack. Call an ambulance immediately and get them to the nearest hospital, not to the hospital that you think is where they should be. They need to
Yeah.
first get first aid, to get them to the nearest hospital. Could be even a clinic, but get them to the nearest place so they get at least first aid in place and then move on. That's how it should
Got,
be.
got it. So aspirin is like
Yeah,
something that
aspirin
we can.
reduces the intensity of the attack, definitely.
Wow. Okay. So Priya, Diksha, the recommended tests, I think doctors just mentioned it. Um, Doctor, I think it'll be great if you just put it there on the chat. If you can, you mentioned the CT coronary, and yeah, so doctor's quickly going to mention the test that he just spoke about. Ani, well, doctor just spoke, he didn't go into the detail of Puneet's condition. He said he was genetically predisposed. So, which obviously most people didn't know. So, everyone attributed it to the fact that, okay, is it because of the workout? But he's also genetically predisposed. Yeah, we're just going to put, okay, I think we're already 1 hour. What are the precautions to take? Long exposure of diabetic water in the morning. Rakhi is talking about something in specific here. I have taken 2 glasses of salted water in the morning, and then I don't feel the headache that I spoke about after exercise. But is salted water harmful?
Yeah, it is not harmful. It is a load of salt on you. So, I mean, if you're taking salted water and your headache is gone, then you're just purely dehydrated. That's all. So the salt and the water is basically adding to your hydration process.
Right, right. How regular to use of aspirin for 60 plus age of people after doctor consultation?
You can take an aspirin a day. There's something called ecosprin or enteric-coated aspirin. You can take 75 milligrams of it. It's a
Yeah,
good prophylactic to take.
right. Farzana, you mentioned tingling and stiffness in hand. Is that like post exercise in general? Yeah. Okay, so doctors put up the test. Is bathing in cold water bad during winter?
No, it's
It's
not. Cold water.
yeah, sorry, I think we yeah, so Farzana is talking about very regular tingling and stiffness in hand.
No, that's not related.
Okay, 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 great. Okay, I think we've kind of, it's already 5 p.m. We've run out of time, but we will, for everyone, for some of the question here around whether the session is going to be recorded and put up, yes, we will put this session up on our community page, okay, on Facebook. So, and we'll share the link there so you can obviously, share it with whoever else you want. Uh, yeah, Rajiv.
So,
Menace origin of RCA from left cup is noted. Sorry, I didn't understand that at all, Rajiv. Yeah, is there I'm going to take this last question. Is there a
right.
relation between vitamin B12 deficiency and vitamin D deficiency and heart health? I think that's a good question because a lot of us do suffer from B12 and D deficiency in general.
Yeah, so there is an indirect connection. Vitamin B12 being very low can cause a lot of trouble, can especially cause severe anemia. Anemia can in turn cause a decrease in the oxygen carrying capacity of the blood, putting a lot of strain on the heart. And
Hmm.
so that is not good to have. And you need to, get your vitamin B12 up. Uh, Vitamin D, there is enough papers to say there are connections, but by and large, it's not what you say. It is not directly. We don't have any hard evidence, but yes, the very low vitamin D levels can predispose to heart disease.
Oh, okay. I think that was that's a good question, Princey, and I think we needed some. Yeah, great. So I'm not going to hold Doctor any longer. I think we've gone past an hour. Dr. Rayan, thanks a million for being here with us. Anything that you want to leave us with, because everyone here exercises. You exercise on a regular basis yourself. But any advice for everyone here who exercises regularly? Because I think most of us just worried about the fact that, yeah, we keep pushing ourselves and, we're just a little scared of the fact that, the recent fit people dying and, all of us exercise so much because we want to stay fit and healthy and then
Sure.
something, yeah.
No, yeah, sir, like my only take home is for those of us who are exercising and let's take the group that's in regular exercise. I think for us, as we age or as we are getting older, one needs to understand that we may not be able to hold on to the same level of intensity or the same, kind of weight that we did do many years ago. We get carried away by that. And we need to focus a lot on mobility to avoid injuries. And we need to, once again, sleep 6 hours, pay attention to that, make sure we sleep 6 hours and eat healthy. For those who are just starting off, be it youngsters, be it older, whatever it is, start slow, take guidance, work with trainers, work with people who understand what it is to train people. Internet-based training is good. It's like anything else on Google. It will tell you everything under the sun and not tell you what's wrong with it. And then you're going to hurt yourselves. Not advisable. I think you will understand that there is a method to everybody's madness, and it's that method to the madness that makes it actually why they are doing what they're doing. It makes a lot of difference. Being an elite athlete myself, I always go back to people who I trust my body with. I go back and ask them, how do I start? Where even if I'm doing it by myself, I make sure that I'm talking to someone or I'm actually taking instructions from someone. So I think that is important. It is necessary to be guided, especially when you're starting off. And in this field, I think as we age, it's good to be guided always. That's what I would
Yeah.
recommend. There is value to the guidance. There's no question about that.
Yeah, so true, doctor. Thank you so much. There's one last question about does night shift, can cause any sort of heart attack?
Night shift disturbs your entire biological rhythm. That's the problem. And so you need to make sure you get sleep. Otherwise, it's never the same as sleeping at night. So you will need to figure that out where you get your breaks at least to catch up on your sleep.
Right. Great. So thanks so much, Dr. Rayan. And this session we're going to record and put it up. I mean, it's recorded. We will share it for everyone else who couldn't be here listening to you. We'll share it on our community page. And yeah, thank you
Sure.
so much. Thanks everyone for,
Thanks.
logging in and listening and asking your questions. Take care and please don't, worry about, your workout and don't just keep relating it to heart attacks. I think he's kind of clarified everything for all of you. Yeah, take care, keep moving. Yeah, have a great weekend. Bye.